Good evening to all the participants from India and Greece, and very warm welcome to all the attendees who are attending today's webinar. I, Dr. Shivam Bharadwaj, COO and Co-Director of CynoDent India. I'm the host for today's webinar. I'd like to introduce my co-host, Dr. Anu Vashisht, Membership Director of CynoDent. I would like to thank Dr. Anmol Bagaria to organize such a wonderful webinar today. First of all, I would like to introduce the CynoDent India. CynoDent is a unique platform, first time in India, the digital healthcare platform that provides and enhances a good relationship between patients and doctors. It enables a real-time scheduling system. Our goal is to create easy access to healthcare services and communication ways or appointment scheduling system, not only between the dentist and the patients, but also for the medical practitioners, diagnostic labs, to the radiological services and the pharmaceutical services too. Our various research and educational program is organized for doctors to enhance their knowledge and keep them updated. CynoDent provides services at economic prices with minimum waiting time. CynoDent is here to create precious and healthy smile to our patients' faces with minimum effort and maximum welfare. Now, patients do not have to fear of those long queues because of their toothache. So after this amazing introduction of our platform, I like to introduce about today's webinar topic. Well, one of the modern innovation is regenerative medicine, which is inclusive of tissue engineering and non-engineering approaches to repair and reconstruct damaged tissues. Use of platelet concentrates for in vivo tissues in which we are having platelet-rich plasma (PRP) and platelet-rich fibrin (PRF). PRP has reported great advantages because of its osteogenic potential. So with this little introduction, I like to announce today's topic, that is PRF in regenerative medicine. Let's know about in detail with our esteemed speaker today's, that Dr. Cleopatra Nacopoulos. She is the first doctor worldwide doing facial aesthetics in medicine and dentistry with the PRF liquid. Let me glorify her introduction. She is BSc, DDS, MSc Oral Biology, MSc Periodontology, MSc Aesthetic Medicine, MD Lasers, PhD. She is founder of Cleopatra Technique. Professor Cleopatra has Bachelors in Biology from GANNON University, USA in 1985, and DDS from the School of Dentistry, University of Athens in 1991. She has done Masters in Oral Biology, Periodontology in 1998 and Aesthetic Medicine from the Queen Mary University. She has done PhD in Aesthetic Medicine from the Laboratory of Research of the Musculoskeletal System from the School of Medicine, University of Athens in 2015. Certificate Master Degree from SOLA Academy, University of Vienna in 2005. Trained on facial aesthetic in Beverly Hills, California in 2007. Associate Fellowship of WCLI World Clinical Laser Institute in 2008. Diplomate Certificate Degree of ICOI in 2013. She is a visiting professor at the University of Nikolae, Testemitanu State University of Medicine and Pharmacy of the Republic of the Moldova, Europe. She is the president of WAU-PS Greece and WAU-PS Aesthetica and ex-vice president of the Greek Leisure Applications Company, SOLA. International ambassador at the American Academy of Oral Surgery, scientific associate of the Research Laboratory of Musculoskeletal Diseases of KAT Hospital. She is a visiting professor at Universopolis University. She is the owner of private clinics in Athens and Tripolis, Greece, specialized in periodontics, microsurgery, oral implantology, laser, and facial aesthetic. She is the inventor of Cleopatra technique and scientific collaborator of the research of the musculoskeletal system of Athens Medical School. She has published many scientific papers in her field of interest, GBR, with the use of PRP, PRF implants and laser, frequent speaker at many conferences, and active participation in many scientific companies as a member too. After this wonderful introduction, I like to uh, proceed further with none other than Dr. Cleopatra to hand over for this wonderful webinar. I'm very excited, ma'am. I'd like to introduce you. Thank you so much for coming. It's our honor to have you here, sir. Here, ma'am. Thank you, ma'am. Thank you so much.
Thank you so much, too. It's a great honor for me to be back in India. I've been coming to your country many, many times. You're very nice people. I had a great time. I met very important scientists. I have many, many friends there. And of course, when I got the invitation from Dr. Assis Pandey and Dr. Bagaria, I accepted because I really want to help the dentists in your country to improve their knowledge and their skills about the regenerative medicine. One important factor is right now the world has changed. Our lives have changed, and the reality has changed. We live now, we don't know what is going to happen the next moment. So let's enjoy every moment. Let's use every single moment to improve our knowledge, to be better people, and to try to do our best for our patients. Today's topic, as I said, is going to be about regenerative medicine. For me, this is very, very important because right now, in the era that we live, we want to do and to use as many as organic and natural products we can. We like to have organic food. We want to wear clothes that they don't have all the plastic and the nylon and all these artificial materials. So why not to use our own blood in order to repair our damaged tissues? And when I talk about damaged tissues, they might be like the heart or the soft tissue. And for me, as you said, I am a dentist, but most of all, I'm a biologist. I did my studies in United States, and at that time, I did a lot of medicine. I did a lot of research, and my mindset is always about biology. That's why I did all the things I have done. I finished one degree, I went towards another direction, then this direction took me to another one because my internal goal was to improve my skills and to do my therapy, my treatment to my patients the best it could be. So the home take message for all of you is to try to improve yourselves, not for the money, to improve yourselves selves only for the benefit of the humanity, because this is make you a better person. This makes us all better. And right now that we have the COVID, we really understand how important this message is. I don't want to take your time. I will share the screen, and I am going to talk today about the regenerative medicine, about PRF aesthetics, about Cleopatra technique, and of course, I will start with dentistry. As you said, I have come a long way in order to be able to stand in front of you and just show my work and give you all this information about regenerative medicine. As I told you, from the first time that I went to school, I wanted to do something for the benefit of the people, because for me, this is the most important. The most important is how you can improve your work better. So that's why I came towards the PRF because long time ago, back in 2003, PRP was introduced to me. From the first time that I saw the benefits of the platelet rich plasma, and of course I was combining this with laser treatment, I was seeing very good results. People were very, very happy with the outcome of the treatment. And the post-surgical way that the tissue were healing, it was just amazing. So I decided to spend a lot of time. I have done thousands of cases in order to be able to give you all this information today. And why I went towards aesthetics. You mentioned that I have my PhD in facial aesthetics. No, my PhD is about bone augmentation and with the use of platelet-rich fibrin. Because as I told you before, I was using PRP. Then I was introduced by Ziv Mazor to PRF. I have met Joseph Choucroun. We have done lots of cases together. We have done a lot of conversations, agreement, disagreements, but we did a lot of things in order to improve not only the outcomes in dentistry, but in facial aesthetics as well. As I told you, as you told us, back in 2007, I started doing facial aesthetics with fillers and Botox, and I was trained in California. By using PRP, I had the idea of using PRF for facial aesthetics. And that's why I am the first person worldwide that I have published in the book of Regenerative Dentistry by Joseph Choucroun and Rick Myron about facial aesthetics with the use of PRF. And I did that because I am obsessed with organic things, with natural things, with things that they cannot harm the patient. So the blood is the most safe, the most predictable, and of course is the cheapest way to rejuvenate your face, and not only. So my motto is to stay young with your own blood. As a dentist, I face a lot of cases, a lot of challenging cases. And of course, as a periodontologist, implantologist, I have to give solutions to cases that they are compromised. Such this one, she was wearing a full denture in the upper jaw, and she had periodontitis in the lower jaw, and you see the prosthetic work that she has. And of course, she had lots of problems because there wasn't any stability to the denture in the upper jaw. So this patient was in a bad shape. She was in a bad psychology, and she wanted to have a solution. And of course, as you see, it's very difficult to have an overdenture in the upper jaw that doesn't have any stability with something which is stable in the lower jaw. So in this case, let's start from the upper jaw. You see in the left side that there is no bone, and this was done, and this was the cause of taking good care of the extractions, and they didn't do any regeneration. So she has a very big resorption, and of course the denture doesn't have any stability in the lower jaw. She has her teeth, they have periodontitis. She has lost the back teeth, so she doesn't have any bone. So we have to find a good solution for this lady in order to be happy and to be able to chew. So we decided to extract all the teeth in the lower jaw. We did it with a full flap. We cleaned the post-extraction sockets very well, because PRF doesn't work as a magic biological product. You have to know how to do oral surgery, how to extract the teeth, how to do the osteoplasty, and of course, you should know how to insert the implants. But we have to understand that by using all these blood derivatives, we cannot really have very good results if we don't follow the following steps. For example, we have to pick a very proper surgical technique. We have to know how to manage the hard and the soft tissue. And of course, if we are able to use PRF, platelet-rich fibrin, we know, because there are publications about that. This is one of the publications that I had when I did my PhD, that we can accelerate the wound healing. And of course, at the end, we should be able to close the flap. All the things must be done properly in order to have good results. Platelet-rich fibrin, for me, it's a powerful biological product that can enhance healing and sometimes can give us solutions. For example, if we have a post-extraction socket and we want to enhance, to multiply the soft tissue, if you put platelet-rich fibrin, this is going to give you a big soft tissue. If, for example, we extract a tooth and we put the platelet-rich fibrin, we know that we're not going to have dry sockets. So all these things are very, very important in order to be able to have a good surgical outcome. So we can make PRF as a membrane. We can make sticky bone. That means we just mix the graft with PRF and we make the sticky bone. Or we can use PRF in a liquid form. Doesn't matter, but we use PRF. We put PRF on the bone and then we close the tissue. So this is the way that we use PRF, either as membrane, sticky bone, or in a liquid form. In the upper jaw, as I said, we had a lot of problems, but we didn't have any bone. So we couldn't put any implants. And in this case, we wanted to do a vestibuloplasty. So what we decided to do? We decided to do the vestibuloplasty, then we took the old denture and we screwed the old denture in the upper jaw. So this is how we finished the surgery. This is the sinus, you see here how it is. And of course, then there is no soft tissue, only here the periosteum. So what we do, we put the membranes of PRF in order to accelerate the soft healing, soft tissue healing, and we screw, as I said, the denture in the upper jaw. We keep this denture there for 10 days, and then when we remove the denture, as you see here, we see new blood vessel formation. So now we know that we can regenerate the tissue because God can generate, but as people, we can try to regenerate the tissues. So you see from both sides how we could get soft tissue from only using PRF. And in the lower jaw, because she had the denture and when she was biting, she traumatized the lower jaw, we were able to inject PRF liquid in order to enhance the tissue healing, because this is very important, especially in these cases, because you have inserted the implants and you don't want this trauma to be contaminated from bacteria from the mouth. So you see how the upper jaw was made after the vestibuloplasty, and of course in the lower jaw we inserted 6 implants, and this is, this is the patient with the denture in the upper jaw and with the implants in the lower jaw. So you see a patient with no teeth, a patient that is not happy, the patient that cannot eat, cannot socialize, with a patient that has teeth and it's happy. And this is a very challenging case because we have to try to combine something which is totally movable with something which is totally safe in the lower jaw. And I want to say some words about facial aesthetics. So by having all this background about oral surgery with the use of PRF, as I said before, I decided to use it in facial aesthetics. So if we're talking about the facial aesthetic procedures, we can go both ways. We can go surgical and non-surgical. And of course, as dentists, we should stick to non-surgical way, and we have some products that can be injected inside the skin, and these products can be divided into categories: the non-autologous, and the most well-known are the fillers, with the king of fillers, PRF, and the botulinum toxin. From the autologous, we have two very valuable biological tissues. These are the fat and the blood derivatives. And of course, fat is very important because fat has the adipose stem cells, and not only the fat can maintain and restore the lost volume of the skin, but this is not so easy in our hands because we have to do it in the hospital under the supervision of a medical doctor. So for us, it's easier to use the blood derivatives. And of course, by going autologous, you see what we can do with the use of blood and what we can use what we can do when we use the fat. And of course, the question is, what is happening if we're able to combine these two, the blood and the fat? And we'll see. As I said before, my obsession is about the regenerative medicine. And as blood derivative protocols, we have mainly three. These are PRP, PRGF, and PRF. These blood derivatives products are very safe, non-toxic. They don't cause allergic reactions, and of course, they don't harm the tissue. And the king for me is PRF, because PRF doesn't have any artificial material inside the tube, so you can use it and you can re-inject it in the human's body without worrying about any complications. And of course, we have the stem cells therapy, that they are very valuable because, as you know, the stem cells can repair and regenerate the tissues. So we're using the components of blood, and what actually we do, we are based in a platelet concept. So we take the blood from the patient, we're putting the blood in a tube, and then we centrifuge the tube. And what do? We increase the platelet number, the leukocyte number, and of course, the stem cells from the peripheral blood. Now, as I said, we have mainly three protocols: platelet-rich plasma by Marx, 1998, PRGF, plasma-rich in growth factors by Anitua, another year after, and in 2000, we have the platelet-rich fibrin by Joseph Choucroun. Now, about the platelet-rich plasma, there is no consensus about the count of the cells, the speed that we centrifuge the blood, and of course, the time. Now, we are going to concentrate on PRF, platelet-rich fibrin. This is, of course, the last generation of platelet concentrates. And of course, this fibrin matrix, it is composed of regenerative cells. We are based now on the low speed centrifugation concept. And with this concept, we're reducing the G-force in order to save more cells. So we are able now to have PRF in an injectable form. This PRF is enriched in white cells, And this is very important because this is promoting the soft tissue healing. Now, nowadays, we have the PRF tubes. These are the new tubes that they come in this package. It's totally sterilized. The size is 13 ml tubes, and we can either prepare the IPRF plus protocol, and of course, this protocol, it is proven that can create more cell migration, cell proliferation. We can synthesize more collagen, and of course, is more superior than the platelet-rich plasma. So now my message is go with PRF. PRF is totally safe, and it is proven that it is working. So now we know that we can get more collagen type 1 with IPRF+. But if we're talking about more challenging cases, cases that they have lost tissue, we need to get more collagen. So in order to get more collagen, we have to increase the fibrinogen. So we're making the APRF liquid. This is the second form of PRF. And of course, this is a biological filler in order to fill the wrinkles and improve the skin augmentation. So I strongly believe that as you use PRF in patients over the age of 30, you have to combine APRF and IPRF+. So as doing this combination, now with PRF, we are able to talk about the scientific evidence in tissue engineering because we can create regeneration. And how can we do that? By new angiogenesis that can happen with the inflammatory cells, the growth factors, the liquid fibrin, and of course, the stem cells. So how the idea of Cleopatra technique started? We know that PRF is working with trauma. We have a post-extraction site, and we put PRF, and we have rejuvenation. We use it on the soft tissue, the gums. We add PRF, we get gum rejuvenation. So we have the proof that this is working. So we do the same thing. We traumatize the skin, we apply PRF either topically or inside the skin, and of course, we're going to have the rejuvenation. So it can be added in either IPRF plus or APRF liquid or in combination. So my idea and the name of my technique happened due to my name, because my name has history. Cleopatra was a very powerful woman. Cleopatra loved beauty and cosmetics, and of course, Cleopatra used only natural products. So if we can achieve what we want with the use only of our blood, I think this is very important. This is number one. And number two is, as dentists, and not us as dentists, and doctors and nurses, they use something which is very attractive as a name to the patients. This is the benefit for the treatment. For example, they say vampire mini lifting, Dracula mini lifting. I think this is not so pleasant as a name. But if you name a technique like Cleopatra, everybody, they have in their mind that something is so beautiful, it's so nice, and they want to do it. So I think you will love the name, and of course, your patients. Now, we have done a study using the length of the telomere in order to identify the satisfaction of the PRF treatment. And of course, the result was that people were very satisfied with this PRF treatment. We could measure that by the telomers, and of course, we can use the telomers in the future in order to design more studies. The other study that was done, it was about me and Dr. Anna Maria Vesala, who is an oral surgeon, about the lower facial regeneration with a combination of these platelet-rich fibrin liquid matrices. And we concentrated in the perioral area. And of course, it was the first time that Cleopatra technique was published. The conclusion is Cleopatra technique is a well-tolerated and effective method of lower facial regeneration. And of course, we should do a lot of studies. We should work in different parts of the face, around the eyes, on the forehead, on the cheeks, on the neck, in order to evaluate this kind of treatment. But I will publish soon my new technique, Cleopatra Technique Plus, with the use of hyaluronic acid and PRF. And I will show you that the case, even after 2 years, is better than when I finish the treatment. So this treatment is very effective. And I guarantee to you, if you do it the proper way, will last over the 2 years. And the important thing is that try to learn this technique from me, because a lot of people, they want to teach this technique, but they don't know what I know, because I am the inventor of this. Now, as a procedure, it's easy and it can be applied to men and women. And of course, nowadays, a lot of men are taking great care of themselves, of their skin, and they're seeking all these kinds of aesthetic treatments. So we should know how to prepare the skin. We should know how to anesthetize the skin, when to use topical anesthetic, when to use a local anesthetic or a nerve block. And of course, Cleopatra technique is a philosophy. It's not only to draw blood and inject it inside the skin. We have lots of ways of identifying how this case will be done properly and with great success. Now, about the materials we use, we don't need a lot of things. We need to know the technique. We use either a derma pen, derma roller. We can use our own syringe. That's the little things you need for this great treatment. You don't need to spend a lot of money, because if you don't spend a lot of money, this treatment will be affordable to a lot of patients. And of course, you're going to have lots of benefits. As a procedure now with the blood drawing, we have to be very careful. We have to disinfect the skin, because if you draw blood, you don't want to transmit the bacteria inside the skin. And of course, we can rejuvenate the skin with the use of a derma pen, for example, and we can use our syringe, we can use derma roller, and we know that the microneedling with PRF provides skin rejuvenating benefits to many skin types. That means people with black skin, people with brown or dark brown skin will have benefits from this treatment. This treatment is not only for 1 or 2 types of skins. It's for all of you, for all the people will benefit from this treatment. And the microneedling treatment, we know that helps us for cell replication and collagen production, and allow patients to tap into their body's own ability to produce younger looking skin without a surgical procedure. So to a technique which is well established, such as microneedling, we add the powerful product, biological product, which is PRF, and of course, we accelerate all these benefits that we get with the microneedling. And of course, over the time, by using the PRF, we can see a very fresh, a very glowing skin. You have more youthful looking. The skin is pink, is not pale. It's not dry because we rehydrate the skin. And of course, this treatment can last over 24 months. And this is very important. Now, the microneedling is an easy procedure, is the best way for you to start the treatment. And of course, if you are going to do this kind of treatment, you know that you can get the benefits of microneedling, as I said before, and the use of PRF. Oh, okay, no. The protocol is simple. We do one treatment every 15 days. If the treatment is more superficial, if the treatment is more aggressive, we add the time more, like 3 weeks to a month between the sessions, and we do 3 to 4 sessions in total. We have other techniques such as point by point or micropapular technique, and with this technique, we can inject either IPRF plus or the combination I and A inside the skin. The face right after the treatment doesn't have any aggressive signs. It's a little red with some papules, because in this case, I have done both treatment, microneedling and micropapular technique. Now, if the patient is over 35 years old, then the needs are more. We have to restore the volume, to eliminate the wrinkles, to contour the face and the lips, to correct some asymmetries, to treat the acne scars, to treat the keloids. We have many things. So Cleopatra technique is the ideal method, is a combination of these two protocols. And of course, we can treat the patient after this treatment with a face mask, which is full of good ingredients, or we can use laser or low-level lead treatment. The easiest way is to apply ice, but I prefer to put like a mask or something like that. Now, as I said before, important is not only the pre-treatment and the treatment, but the aftercare treatment. So we have to give instruction to the patient, like to use ice, not to be exposed to the sun or to the heavy exercise, to use sun protection, and of course, to use a cream 3-4 times a day in order to hydrate the skin. I will now present some cases that I did with this treatment. You see the results. The results are very natural. The results are respecting the contouring, the shape of the lips. We don't want to change the natural shape of the lips and make people like ducks. And of course, we can treat the perioral area with this method and get good results that last up to 2 years, and in some cases, even more. We can treat the area of the forehead and the area around the eyes. And of course, in this case, I did 4 treatments. If I was continuing doing more treatments, the results could be more promising. And as I said before, I am going to present my new technique, the Cleopatra technique plus. This is in combination with hyaluronic acid, and you see the results before and after. The quality of the skin is has improved, and the augmentation of the skin as well. And this is a case that I did starting from 2014 until 2016, only with the use of PRF. So this is how I went in these 2 years, how I changed the face. And after that, I used the combination I add some hyaluronic acid with PRF, and you see the results. And at the end, this is the same patient with the dental and the facial treatment. And this is the home take message. If we're able to give happiness to the patient, to give something which is in total, we reshape the face, we give back some years. In some people, we give 5 years. In some people, we give 10, 15 years. It's like a facelift in the most natural way. And of course, as I said, I am not only using the blood, I am using the blood in combination with other treatments. And in some cases, if I want to restore the tissue more, I can use the PDO threads, and I use again them with the combination of PRF. Now, a lot of people are asking me about botulinum toxin. Of course, I use it, but I have to use it always. If I do the treatment with PRF, I have to wait at least 1 month and then do the Botox. And when the Botox wears off, then I can do my treatment and then do the Botox. Because if I do Botox and I do immediately the PRF treatment, because with the increase of the microcirculation, I am going to lose my botulinum toxin. This is a case that I did. She came to me to do Botox. When I finished the case, I saw the pigmentation on the forehead, and after 4 months, I treated her with my technique for 4 times, and you see how the color, the pigmentation has decreased, and how the forehead has changed in color and the skin has changed in quality. In the beginning, I was mentioning that in some cases, we can combine the blood, PRF, with the fat. This is the ideal situation. These are 2 cases that they were given to me from Dr. Brazzini. He's a plastic surgeon from Nice, France, and you see how good results we can achieve with this kind of combination treatment. But we can use PRF not only for aesthetics, but in order to repair some complications due to fillers. This is a publication that I did with Professor Gannati. And of course, it was a lady that she had done hyaluronic acid in the temporal area. She had got in a big infection in this area with fistulas. You see here that she has fistulas and how the skin was after the surgical excision. And after injecting PRF inside the skin, after 2 years, the skin was in this situation. We can use PRF in regenerative medicine in order to accelerate the healing in the amputation cases. And this is very important because when you have an amputation, you have to add the prosthetic limb as soon as possible, because the brain cannot just cooperate with the prosthetic limb if the time is too long. So this is very important to have a tissue that is healed. And you see how the healing is after. And of course, these are some other cases that we can treat some diabetic ulcers with the use of PRF. I will present to you a case of a burn. She had a burn on her breast for 15 days. It was bleeding, and she couldn't have the proper healing, even if she was taking antibiotics and she was putting some ointments. So I made the PRF membranes. I clean the breast with saline water. I put the membranes on the breast and I sealed it with a plastic and these band-aids. 2 days after, she sent me from her iPhone the 2 photos when she removed the plastic and when she removed the PRF, because she didn't want it to keep it more, because she was afraid that she might get to an infection. If she could leave it for a week, it could be ideal, but nevertheless, you see how the tissue became after 1 week. We can use PRF, IPRF plus for hair treatment. You see the results here. And of course, these are very promising because we can revascularize the hair bulb. We can use PRF for arthritis treatment, and I'm not talking about cure, I'm talking about treatment. That means we can reduce the pain and we can increase the mobility. We can inject it either in the knee or we can inject it inside the joints. And of course, the patient after these treatments, 3 treatments, has almost no pain with the ability to move his or her hand. So I will close my lecture by inviting you to Athens, Greece. I hope that COVID will be cured very soon. I am praying and hoping that we're going to have the vaccine and you are going to be able to come back to Greece to share with me knowledge and not only fun. And in my clinic, I organize courses and I show to you step by step the philosophy of Cleopatra technique, not only the procedure, the philosophy, because the philosophy is making all the difference and you're working lively on patients. So let's keep in touch. You can find me, these are my profiles, Cleopatra Nacopoulos and Cleopatra Nacopoulos. I have 2 pages, Cleopatra Technique of Aesthetics and Cleopatra Technique of Aesthetics 2. And I have 2 Facebook groups. I join you to be a member and you can add your friends, your colleagues as members, is WAPS Aesthetica and Aesthetica by Cleopatra Nacopoulos. You post your cases. You might get criticism, but criticism makes us to try to be better. If you're interested in my courses, you can find information in this page, GMDA Workshop Hub, Medical Dental Aesthetics. And of course, nowadays, things have changed totally. So I don't do courses in my clinic due to COVID-19, but I do live webinars. We have the computers. I show you step by step the technique, and you have your computer and the equipment, and you do step by step what I do. If you want to get in touch with me, you can send me an SMS. You can send me an email, or you can send me a message through my Instagram, Cleopatra_Nacopoulos. Now, I have to announce that I am going to have a webinar with training. This is going to be November 28th and 29th, and I am going to talk about the use of filler, hyaluronic acid, because I believe this is the safest one, with the use of PRF. Fillers are very well known right now, and I am strongly convinced that you should use them in your practices. If you're using hyaluronic acid and you learn very well the technique, it is safe, it's simple. It might have some minor ecchymosis for a few days, and of course, ideally can be combined with Cleopatra technique. When you inject any kind of artificial material. Less is more. So we want to play and stay safe, because we don't want to harm the patient, because with hyaluronic acid and with other fillers, if you don't know how to do it, if you don't do it with caution, you might get yourself in a big trouble. And of course, when you do aesthetics, you have to ask yourselves if it's necessary, what complication you might have, if you have any complication, if you are able to solve the problem, and many other things that you have to be able to do it, and at the same time to repair the complication if you face a complication. And for me, I strongly believe that hyaluronic acid is a safe product, and of course it is a part of ourselves. The problem is how much cross-linked is. And of course, we have to learn, and we learn in my course, how we apply this product in all the areas of the face and how we can improve the face. And of course, we want to give the face a very, let's say, youthful and very happy, very relaxed appearance without changing the authenticity of the individual. Because as you understand, as you know, because you have seen lots of patients, all the lips are not the same. So we have to respect the shape and the contouring of the lips in order not to change the personality of the patient. And I want to announce my next PRF, exclusive PRF course in facial aesthetics, which is going to be in January 9th and 10th. And the innovation about this is that a lot of things will be presented by Dr. Ana Maria Vesala about the trigger points, about the anatomy, about the vascular system of the face. And of course, Dr. Calliope Guscu is going to present, she's a molecular biologist, she's going to present how our nutritional profile can be combined with this treatment, or how we can be predictable with this kind of treatments if we know the nutritional profile of the patient. So thank you once more about the invitation. I hope that your organization will have great success. I can be with you, and I will help you in your future projects. And I hope that COVID will not last so long, and I will be able to be in India very soon. Thank you very much, and stay safe, and let's all be together very soon.
Can you hear me?
Yes, ma'am. Thank you so much, ma'am. Thank you so much for just giving such a wonderful knowledge. It's just an honor to listen all this from you, ma'am. Thank you so much, ma'am.
Okay, thank you so
So much. Bye-bye.
Ma'am, we would take few questions if it's possible. The people have posted few questions in the comment section. It will take another 5 to 10 minutes to cover that.
I have another meeting in 3 minutes. So I have only 3 minutes in order to answer the questions.
Okay. Dr. Anu will conclude the session. You can say a vote of thanks. We conclude the session.
No, I
I can answer to 3 questions, but only 3 questions. I have another meeting.
Ma'am, few of our participants wanted to know that how do we combine IPRF with APRF?
In order to learn all this, they should attend my courses.
Okay. And ma'am, one more question. What should be the time gap between the formation of PRF and the time when we are using the PRF on patient?
Now we have the ability to, with contact, to have the PRF in a liquid form for almost an hour. But this is something that is going to be presented in my webinar in January.
Okay, ma'am. So we are looking forward to attend that. Thank you so much, ma'am, for this amazing session. I would like to thank you and thank Dr. Anmol and Dr. Shivam for being part of this amazing session. And we look forward for your workshop also and your next lecture. Thank you, ma'am.
Ma'am, I would,
Bye, all the best. Good luck.
ma'am, I
Thank you,
would
ma'am.
thank you for
This is
giving
from
us your
Greece.
valuable time. And as a researcher, I wish to come Greece and learn from you more and more. Thank you for giving us your valuable time. It's really an honor and privilege having your love and support with us. Thank you so much.
Thank you. Bye-bye.
Bye, ma'am.
Bye,
Thank you,
ma'am.
ma'am.
Bye.